topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Experts show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, eastern part of the United States. Welcome to another Ask the Experts, where for the last 16 years, we have brought you the finest experts in the field of legal, health, financial, and home improvement. Do we have a show for you today? You know, I've shared with you, and I don't care if anybody knows, I'm on Medicare. I love Medicare. But the one thing you've really got to be careful of is you got to have a great agent. I am telling you, that is the most important thing when it comes to Medicare, because I had the worst agent ever. And now I got to tell you, I've been so impressed with our guest, our expert, Stephen Fromm, that I've actually secured him to handle all my Medicare needs. Good afternoon, Stephen.
Stephen dropped off. I'm sure he'll be right back, but
Okay.
He disconnected.
Hey, things happen. You know, this is a live show, and I got to tell you, things happen when you do a live show. It's amazing. But you know what? It's so much better live than it is pre-recorded. So we're going to wait for Stephen to come back on. I hope I didn't have any. There he is.
The internet.
Hey, bro, it happens. You know, I've seen it happen on Fox and CNN and all the big networks. They freeze up. They lose people. It's not just because we have a very sophisticated system, but I was telling people how important it is to have a great agent, and I am so pleased with you that I have retained you as my new Medicare agent. I have never done this in 16 years on any of our categories. But, bro, I'm so impressed with you. I'm so blessed that we have you. And good afternoon to you.
Good afternoon, Steve. And as always, I appreciate all of your support. I love doing this show. Feedback has been great. We are making such a positive difference, helping seniors, educating them. You know, as you know, for me personally, I always like to kind of pick a topic, talk about that, you know, and just educate our audience, you know, and just try to really make a difference. So today we found out actually, like to talk about Medigap plans for a second. You know, Medicare supplement, Medigap plans. You have Part A, which is your hospital. You have Part B, which is your doctor, and they cover 80% of a healthcare expenditures. And then we write that Medigap plan to pick up the remaining 20%. I was shared today an article that talked about for 2026 that for Medigap plans, the average rate increase is going to be somewhere between 12% and 26% this year.
Wow.
Those are some dramatic numbers that are going to affect a lot of seniors and how they move forward with their Medigap plans. You know, for some people, it's going to become cost prohibitive. And, you know, we might have a conversation about maybe having to go to a Medicare Advantage plan right now. And it's important for people to understand as well as, you know, when they do enroll in a Medigap plan, you know, are they enrolling under, is it issued age or is it attained age? because the difference is very large, and depending on how those rate increases will affect everybody. So that was a very interesting article that came across my desk this morning, literally this morning. And I was like, wow, I got to make sure I talk to all my clients as soon as possible.
Stephen, I got to tell you, one of the things I just love about you, besides your first name, one of the things I love about you is you're constantly thinking about the little extra things that you can do for your clients. You sent me what I call now my care package, and I've got another one. I mean, look at this, Stephen. I'm going to show everybody this. You see, does this look familiar to you?
Judith, that's Judith, part of the senior survival kit, as she calls it.
Yes, yes.
Senior survival kit. And those fans are great because they're not battery operated. It's got USB, plug it in, charge it up, walk it around with yourself, and maybe you have an extra battery pack if you're out, charge it up. It's perfect. And you're in Florida. It's even better.
Yeah, well, I'm going to tell you something. There's all kind of little trinkets out there. And I got to tell you, Stephen, most of it's crap. Everything you've done is like first quality.
Well, and that is what we strive for.
That must be how you treat your clients. Everything is first class.
That is exactly how we treat our clients. Every conversation I have this week with everyone is so different because, like I talk about in my in-person seminars and my webinar, there is not one fits all Medicare plan, and only you understand your healthcare needs and your budget. And that's why we go so deep with everybody, understanding, hey, listen, what we talk about today is just not for today. It's for the road, down the road, and client for life, because there's going to be changes in your life. And we want to make sure we're prepared for those changes today for the future. And I know a lot of times in this show, we've talked about coverage and how we want to build that umbrella for everyone we talk to. And recently, what we did is we decided that, I talk a lot about cancer, heart attack, and stroke, and how that is so dear to me because of my health and with
right.
one of my sons getting cancer. And it's so every time I talk to everybody, I like and relate stories. And we just came up with a new slide that talks about, hey, listen, we're always going to recommend gold, silver, bronze, or basic. And basically it's, gold is like a $30,000 cancer, heart attack, stroke plan. $30,000 cancer, 30,000 heart attack and stroke. And that's going to cost you $125 a month. How does that sound to you? Wow. And it's an indemnity plan. And should you get diagnosed, I tell people all the time, I go, should you get diagnosed or something should happen, I want that phone call to be to me so we can help you submit that claim properly and you can get your benefit that you're entitled to. Because whenever those events happen in someone's life, it is traumatic for the family and the emotions just go off the charts. And your mind races and you start thinking of all these things. And hey, listen, if we can help you a little bit, and we've done our job, we've made a difference for your life.
Stephen, there is so many things that people don't know, especially people who are first coming into Medicare. There's so many things they don't know. I mean, and here's just one of the things, I'm with Humana. And that might change next year because I've got Stephen handling all my Medicare. But Humana sends more junk mail than you can ever imagine. And I think about the demographics of the people who get this mail. I mean, most of them are going to be like me. They start chunking that mail away. Well, what if you get a piece of mail that says, we are no longer going to be in your area anymore?
That, as you know, that happened a lot last year during the annual election period. A lot of carriers decided that they were not going to offer their plans in certain geographical areas or certain zip codes or certain states. And sometimes, you get, like you said, you get a lot of mail and the senior may have missed that piece of mail. And, that's important. and maybe then come first of the year, and well, thank God there's still the open enrollment for people on Medicare come first of the year. But for Medicare Advantage plans, you maybe miss something, and it's very important.
Right.
I had a couple of families where my mom lives. The guest on our show, my mom down in South Carolina. I work with a few of the families in the building, and I was proactively calling them like, hey, listen, your plan that you're in is not going to be offered anymore. And they were like, what are you talking about? I didn't get any notices. You probably did, but you just kind of, you missed it. It is what it is. It happens. We all miss our mail sometimes. And they were very, wow, thanks for reaching out, and we make a difference. And that's what we strive for every day, making that difference and building rapport with everybody. I will just tell you, working with a family in Arizona, and Judith happened to be here the other day talking to them, and now the two of them are they're trading cheesecake recipes. So it's like, you just never know. She was sitting here listening to this guy talk about his blueberry, pineapple, whatever cheesecakes, and Judith was looking at him. He's like, get the recipes. So
funny.
Peter's already sending her. It's not sending me. I'm out. I'm the person who eats it. But sending Judith pictures. She's sending him recipes. I'm like, all right. And listen, I get the benefit. All I know is I get the benefit of everything.
Hey, listen, bro. I'm not surprised. Nothing surprises me.
Yeah, but just going back to the Medigap plan, something a lot of people that don't know this as well. We call it Medigap rewrite. And, someone enrolls in their Medigap plan when they're 65 and down the road, they're still healthy, but their premiums have, gone up significantly. We call it a Medigap rewrite. That person, we will, submit a new application for them for free. It doesn't cost anything to a carrier. And maybe they're able to save money each month. Maybe they can save, since they're healthy, $50 a month, for example. And then maybe we take that $50 a month and that goes toward their cancer, heart attack, stroke plan. So there's all different things as we build this giant umbrella for somebody that we're constantly thinking of.
You cover the Florida area. And Stephen, there's so many people who are on a fixed income at this age. And boy, that's music to their ears if you can even save them $50 a month. Yep.
They're big numbers. As my father would sign a certified financial planner. Small numbers become big numbers very quickly. And if you can help somebody save money, that you've just made their positive difference. And maybe it's not enrolling in another plan or something, but just the fact that they have extra money in their pocket right now. And that money means so much to them. So that's everything. Every conversation I've had, every conversation is just different. So different.
Stephen, I also, with your show, we do other Medicare shows around the country and other markets, but I got to tell you, with your show, I want people to understand, first of all, you see these commercials on TV with the celebrities, and you call that company is only going to give you information on their company. And sometimes, Stephen, if you call back again, you might get different figures. With you're not married to one company.
Nope. I'm a licensed independent agent in 38 states, contracted with, over 15 different carriers. So that is one of the things we're always looking at. And that was my conversation with the gentleman in Arizona. We were looking at the various Medigap plans for him. And I was explaining, the plans and the carriers. And that's my job. My job is to educate him and explain and make recommendations. That's always the big thing. Always make a recommendation. I am the expert. So I'm going to make a recommendation to you. And this is what I think you should do. And I'm always going to ask, hey, do you understand what we talked about? Is there any additional questions? And this is my recommendation. We do this. How does that sound to you? Like, wow, that's great. Great. We got that. We're working together now. We're going to move forward and we're going to write the right plan for you based on your healthcare needs and your budget, of course.
Stephen, another thing, this show I really use to educate people how important an agent is. And because today's show, people from all over Florida are watching or listening, And because I'm in Florida, I know. Here's just an example of something small. I asked my original agent because I had a specialist, I had an orthopedic specialist, and I wanted to make sure he was in the group. And the guy said, "Yep, he's in the group." And it turns out, and people see these are the small things. Some of my provider, my primary care, has a little group on the side, and they don't send people to my orthopedic surgeon.
Mm-hmm.
And so if I would have had a good agent, he would have said, yes, it's on the plan. They're on the doctor, but they're not going to cover you while you use this provider, my doctor.
Yep.
There's little small things like that. And I had to go find a new orthopedic surgeon. Even though mine was on the list, it didn't matter.
And now all of a sudden you're talking about an out-of-network benefit.
Exactly.
And that out-of-network benefit is going to cost you more money. And anytime I'm working with families, for example, yourself on a Medicare Advantage plan, we're going to go through every single item. Hey, your primary care is $20 copay. Your specialist is a $50 copay. Your ambulance ride is at $275. Outpatient surgery, you're going to have, maybe a 20% copay, as well as prescription drugs. Chemotherapy drugs only covered at 80%. That 20% is your responsibility, possibly up to your out-of-pocket maximum, and not just your in-network. Could be your out-of-network. And that was a client I had on an employer plan. Her employer plan was a really good plan, and the premium was very low, but her out-of-pocket max was extravagant. And after running the numbers for her, enrolling in Medicare was everything. So those are little things we talk about. What is that? I think I've mentioned a few times on the show. I have a family I work with right now. They're paying $2,000 a month for the cancer drug. It's not covered.
Wow.
Been doing it for 7 months. 7 months now. Times.
How do they do it, Stephen?
They just do it because what is your option?
Right.
You don't have an option. So I actually just enrolled her in the cancer, heart attack, stroke, and she told me how much she wanted. We started at 30,000, and she's like, I am living this every day. I want at least 30,000 for my cancer, and I want at least 30,000 for my heart attack and stroke. I go through this every day with my husband, so I see it, I know it, it's real. So yeah, how do you just do it? $2,000 a month. And unfortunately, the gentleman, before he got diagnosed, we didn't have that conversation, and now the family's dealing with it. And that's what happens. It's sad.
Stephen, what about, I keep hearing that out-of-pocket drug costs are going to be going up.
That is a good possibility. I mean, right now, the $2,100 is the cap for 2026. And, one of the things that we're educating is that, non-formulary drugs, they don't count towards the cap. So, you have to look at what prescription medications are going towards my $2,100 cap and which prescriptions may not be going towards my cap. So, yeah, that number, it went from 2,000 last year to 2,100 this year. Not sure what's going to happen in the following year, but that is something we want to stay on top of all the time. And there's been situations this year where, I've had families where the drug maybe was on one of the tiers and now it's not. So what do we do? What's your plan then? And that's why I always have that education conversation, how, hey, listen, make sure you work with your pharmacist. Make sure you have a plan in case something changes. And if something does change, please call me, because that's my job. My job is here to help you find alternatives. And they do. People call me and we work on that. So whether it's talking to you for, sometimes I'm on a call with 2 hours for a person. But that's what we needed to do. Be on the phone for 2 hours and get this resolved correctly. So,
speaking of big ticket items, skilled nursing, recovery care, you have umbrella coverage for this, don't you?
Yep. We have a couple carriers we work with now that have some really great products. Always a great conversation. Hey, did you know that assisted living is not covered by Medicare? And that is always a surprise for many seniors. What do you mean? Yeah, this living is not covered by Medicare. That is a cash benefit. And, I can help you right now because we have some plans that offer some benefits that could be beneficial for you. And, because a lot of times we talked about previously, some seniors may decide they didn't want to pay for long-term care back then, and then maybe now they don't qualify, or maybe now even they can't afford the premiums. I had that conversation with the gentleman yesterday. He told me he's dropping his long-term care plan because he can't afford the premiums anymore. And he's had this plan for 20 years.
Wow.
He's going to drop it because he just can't afford the premium. So that's why we talked about one of the new benefits, a cost that's something maybe a third of the price for him. And he does, again, you have to qualify. And he did qualify. So all those things, just constantly learning, constantly listening to people. And, every day I learn something new and then I apply it, to my business model. So that's the important part.
And, I'm going to reiterate this, Stephen. Customer care, customer service I've never seen anybody who it's so important to as you.
Well, we appreciate that. And again, it's building rapport, always building rapport. And I'm not, we had a funny situation on Monday. This woman I'm working with in North Carolina, and she's from Mexico City. And as you mentioned, Judith's from Mexico. So she got on the phone with me and I said to her, hey, I have a surprise for you, because Judith was sitting next to me. And the two of them talked for 30 minutes. And that was our bond. And she, when they're done, she said to me, she goes, I haven't had a conversation like that with someone in years. Just building a relationship, not even talking about Medicare, just building a relationship and a friendship. And, what I do then, she values so much more because she realizes, hey, these are real people. They're here to help me. So just little things like that.
Hey, be in my shoes and start off with someone who was so lazy, and then you meet Stephen, and it's just like a difference in night and day. Stephen, Stephen's with us every month. Actually, we do two shows. We do a New Jersey show, and we also do a East Coast show because we want to get all those people in Louisiana and Florida, Georgia, all North Carolina, South Carolina. Tell people how they can reach you, Stephen.
Well, they can always call me direct at 908-268-2356. That's my personal work number. They can also go to the website, which is www.fromme.com. There's a contact form on the website. They can complete that. They can get in touch with me directly. It goes right to my calendar. And through this show, we have constantly built out our website. Now they can go on the website. They can order a copy of our book. We can send them directly a copy of the book. The Medicare 101 webinar is now on the website. And as I mentioned previously, building out a video library. So many questions come up. And I found it easier to help answer these questions, make these 10, 15-minute videos for people. It's a lot of fun.
Well, you're going to be hearing from me Friday. You know what I mean. Stephen, have a good week, bro.
You're going to get this? That's what you're going to get. Mm-hmm.
I can't wait to get it. Tell your wife and Marie hello for us, and we'll see you next month.
All righty. Thank you very much for everything. You guys have a great day.
Love you, bro. That's Stephen Fromm. I am telling you, folks, you're getting ready to go on Medicare. You're already on Medicare. Give Stephen a call. We're going to go to a quick break. We will be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.